Liz, I'm not sure if you know how much you know about our group, so we might start off with, I know you're getting familiar with this by now, but a couple of questions that we'll ask you, and if you can, by show of hands, just let us know your answers. So how many of you are graduate students? And how many of you are undergraduate students? And then we have some recent grads, I think. Yes, awesome. How about STEM majors? Everyone here is a STEM major. So let's go deeper into STEM. How many bio majors do we have? Does anyone have bioengineering? Is there biochemistry, chemistry? Did I miss-ish? Okay. What's your major? Yeah, sure. Chemical engineering. Okay, so we've got a mixture of biochemical engineering. How many of you are from New York City? Almost everybody. How many of you are attending college or university here in New York? Great. And we'll do our borough tour here. How many of you are from Brooklyn? So representation, Queens. Woo-hoo. Manhattan. Yes. Staten Island. Not today. We have had a lot of Staten Island representation this week. And Bronx. Woo. Yes. Wonderful. So hope that gives you a little bit of a sense of who we are. We'd love to hear a little about you. So you've had we'll get into your path, but maybe just tell us a little of your background and what you do now.
Sure, thank you so much, and hi everybody. It's great to be with you this morning. So I am part of the office of the First Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. It's a fairly new office. It was created during the response to COVID-19, really out of the understanding that centering health equity, social justice, and racial equity in everything that we do is something that needs to be strategically and thoughtfully and consistently led, both in our work at the health department and in our collaboration with other city agencies, community partners, industry, and others. So, like Anita mentioned, I lead a project called Take Care New York. It's a health equity roadmap for the city of New York. It includes three kind of big components. The first of which is data. So we've built a data architecture that helps folks who don't necessarily think of themselves as part of the public health ecosystem find their way into the work of advancing population health and also health equity. So really thinking about how to close the gaps that exist in both the drivers of good health and in health outcomes. The second thing that we do is we build networks. We go out, we work with partners across sectors, we build coalitions, we help folks collaborate, and again, really find the sets of thinkers and doers that can come together to tackle some of those complex problems. And finally, we focus on action. We do research, we do policy, we stand up programs, all within the aim of building this all of government, all of society approach to advancing health equity. During the response to COVID-19, we met with about 5,000 New Yorkers to have deep conversations with them about what creates health and what helps them stay healthy. And we've been using what we've learned to build the next iteration of our plan, which we hope to release this year. What we learned from those conversations was really kind of three big ideas. When it comes to creating health, doctors in medicine are important, but what matters really is where you live. And what your identity is intersects with your experiences of where you live. And then finally, thinking about the relationship between the public health system and the healthcare system. So we're thinking through place-based strategies, identity and community-based strategies, and then strategies that really expand that connection between public health and healthcare.
Wow.
In a nutshell.
That was really interesting, and I'm going to comment editorial privilege of the moderator here, that was also beautifully expressed. Did you notice how she said there are 3 things that we do, and what we learned from this was, so if you think back to Pamit's presentation on the first day when he was talking about how do you give a great presentation, Liz just demonstrated beautiful structure. I'm sorry to call you out publicly. I'm giving you positive feedback publicly. I didn't ask for your permission, but editorial comment that's a great way to present yourself. Okay, now we'll come back to the content. So, but this is all really interesting, important, critical, especially in a time of public health crisis. But I don't believe you came from public health. So can you tell us a little about your path?
It's a great story. So I went to art school in the early 2000s. I focused on printmaking and sculpture, and I was wrapping up my studies. My thesis advisor sat down with me and said, "Do you know what urban planning is?" And I said, "Nope." And she said, "That seems to be something that you're interested in. Cities, complexity, density, diversity, those are all themes that are coming up in your work." And fortunately for me, her husband was an urban planner who needed an assistant. So my first job out of college was literally taking pages out of the New York City zoning resolution as they expired and replacing them with new ones. I learned how to do calculations to understand the way that the zoning resolution applies to the design of the built environment. But more interestingly, I got to work on some big national projects that introduced me to some of the ideas that kind of continue to inform the work that I do today. We brought together a team of folks from around the country, including public health researchers from Harvard, who taught us about this idea that, again, in the early 2000s was still fairly new. The idea that your zip code was more important for your health than your genetic code. So in a room full of architects and urban planners, hearing folks say that actually when we talk about something like diabetes or other chronic diseases, the stress of living in disinvested places is enough to trigger the body to produce sugars and lead to diabetes and other chronic diseases. And we were all just like, wow, this is incredible. So from there, I traveled on in my work to do more community planning. I taught for a little while. But when the opportunity to come to the Department of Health to do work at the intersection of urban planning and public health arose, I jumped on the opportunity. In my interview, the interviewer said, you know, what is it that makes you want to come work in public health? And I said, hello, the Croton Aqueduct. I was like, this is the place. So I've been with the health department since 2015. I've worked on a wide range of projects, everything from thinking about how to increase uses of active transportation and improving the built environment. I've done a lot of work with public housing, and now leading Take Care New York, which is this kind of comprehensive approach. Throughout all of it, I've really worked hard to maintain my identity as an artist. I think artistic practice offers a lot of tools and strategies that folks don't often encounter in government work, but gives us new ways of interacting with communities, problem solving, and just working together. And it's been a real privilege to get to do that work in that way, in that kind of a space.
So you're saying, just because of where we live, we might have elevated stress levels, sugar levels, higher incidences of diabetes. Can you just talk about that a little bit more?
Yeah, so I know we've got a lot of New Yorkers in the room, and so folks are likely aware that New York is one of the most segregated cities in the country. And our health outcomes really map to the lines of our segregated neighborhoods. We see differences in life expectancy of up to 10 years between neighborhoods that are geographically proximate, but are really kind of worlds apart in terms of the resources that they receive and the resulting health outcomes. So that is not something that happened overnight, right? Decisions about where highways go, where new housing is built, where food stores are located, all of those accumulated decisions have an impact on our health. So now, as we're trying to think about how to close those gaps, we have to really think about how to engage all those systems and all of those sectors to come to the table to really work on dealing with those issues. So in Take Care New York, we identify 6 key action areas that we really think about. The first, and the one that we hear time and time again from New Yorkers matters the most to them. Anybody want to take a guess? Sector outside of health that you think folks care about when it comes to creating a healthier city?
The economy.
The economy is one, definitely. That is one.
Education.
Education is one.
Public parks, maybe?
Public space, yep, 100%.
Transportation.
Transportation, yep, we kind of consider that all in our kind of public realm thinking for sure. So we've got economy, we've got education, we've got the public realm. We also think about housing, right? That's a huge one. Community cohesion, so the relationships between folks and each other, folks and their representatives, trust, civic engagement, things like that. And then finally, healthcare. So how do we leverage all 6 of those factors in order to close the gaps that we're focused on?
That's a lot to focus on. How do you prioritize what you're going to do?
So the great thing about the work that I do is that it really is about sparking collaboration. And really leveraging the work that other people are doing instead of having to do it all ourselves, right? Because there's no way. I have a small team. We are 5 mighty public health workers. We have a big agency, but even that wouldn't be enough. So what we do is collaborate with other agencies and folks in other sectors. We work really closely, for example, with the New York City Housing Authority. We've got 500,000 people living in public housing and a tremendous opportunity to improve health and health equity by closing gaps in health outcomes between those populations and other New Yorkers. We did a lot of work in public housing during our response to COVID-19, and the impacts that we saw were evidence that when you invest, you can truly make a difference. The rates of vaccination that we're seeing among public housing communities now exceed what we see among other New Yorkers. So when we invest, when we partner with communities, we know that we can really make a difference on the outcomes that we're trying to advance.
We are a group of predominantly scientists and engineers. Public health is interesting. We know it's important. We know what we do helps the patient. But sometimes it's hard for us to see the connection between what we're doing maybe in a scientific lab and the community. What are ways that we might be able to bridge that gap?
I would love to hear everyone in this room answer that question, but I'll give you my answer. So really thinking about that bridge between public health and healthcare, how we think about the health of individuals and how we think about the health of communities, I think is actually some of the most important work that we have to do right now. That divergence between the fields is not natural, right? It's something that happened over time and with intention, and I think with intention we can start to bring it back together. Thinking about preventative health strategies, I think that that's a real place where individual care strategies, scientific research, and public health, that's a place where we can really come together. What are the opportunities that we can take what we're learning and scale it up to the population level? One of the things that we have in New York City is a really incredible public health lab. We actually have the oldest public health lab in the country, and the laboratory science that we provide as a public service is really just truly extraordinary when you look at what exists in other places. So thinking about producing science as a public good, I think, is one part of bringing those things back together and looking for opportunities. I want to invite everybody to consider a career in government and public service, because we need smart people to come and do that work in order to advance those population level goals.
I'm going to give you all a chance shortly to ask Liz questions, and in particular, maybe even take it as a challenge, where she put back a question to you all: how should we all be thinking about integrating our scientific research into the public health space? So you did just start by encouraging folks here to look into a career in government. What would be an entry point? And what are some potential career paths for a career in government focused in health?
Whew, we could spend all day on that one. So like I mentioned, we do have a public health laboratory, which scaled up significantly during the response to COVID-19. We also have a public hospital system. So depending on where your interest lies, those are two good places that folks could really start. The types of careers that folks could get involved with could include everything from laboratory-based work, statistics, analysis, epidemiology, but also policy work and programmatic opportunities to really think about citizen science and how we bring the public into the kinds of work that we do together.
To dig into that a little bit, what kind of background? Rich, do we have a bottle of water? Okay. So I know a couple of people joined a little bit later. We have Liz Hamby here, who is with the Department of Health and Mental Hygiene. She's been telling us about the social determinants of health and how public health is related to, or that the health of our communities is really related to so many things: public space, education, the economy, housing, healthcare. Maybe I repeated that a little bit. But I want to come back to a question for Liz. So we have a lot of scientists and engineers in the room. What are there specific courses that people should take, or degree programs, to be able to pursue a degree, or pursue a path? Let's if we just start with, let's say, the public health lab. How might one get into that?
So I'm going to confess that this is not a strength of mine in terms of familiarity, but I really want folks to know that we have 6,000 employees at the New York State Department of Health and Mental Hygiene, and several hundred who are part of our public health laboratory, several thousand who are part of our division of epidemiology, and another 1,000 in our division of disease control. There is room for you at the health department. And if I will make sure that my contact information is available, if folks are interested in public service, I'll make sure that you get the information that you need about how to get involved.
Terrific. Thank you. So I'm going to ask one more question that's specifically related to the pandemic, and then I'm going to turn it over to you to see what questions you have for Liz. You mentioned that you interviewed 5,000 people in the time of the pandemic. What were you hoping to learn from this work, and what were you able to do with this work?
Absolutely. So I will say, so Take Care New York, the project that I lead, has been around since the early 2000s. It's come about with a plan about every 4 years, and we were set to launch our new plan on April 4th of 2020. So we were going to come out with a new framework, we were going to have community conversations, there were so many things that we were going to do, and of course we had a pandemic instead. So the other kind of funny story, if you think back to those golden days of 2019, we were like, maybe we should do something online. That's crazy. people will never come to an online meeting, which of course sounds totally absurd now. So we did decide pretty quickly in those early days that we would shift our programming online to go out and just talk to New Yorkers about what creates health for them. We knew that our framework was going to have to look different given the experiences that folks had with the pandemic, with the uprisings for racial justice, with everything that was happening in 2020. So we really just wanted to create a space where we could go out and listen. We listened in two kind of unique ways. The first was a more structured conversation where we had these questions related to healthier neighborhoods, promoting healthy childhoods and a life course approach to well-being, and this idea of bridging public health and healthcare. And then we did a less structured approach where we just went out and asked people to tell us stories, to talk with each other about what creates health for them and what their vision of health would be coming out of the pandemic. And so that's where those 5,000 folks participated. We have about 64 hours of audio that we've been coding and organizing to really help us learn from. What we're doing with those insights is building this new framework, one that we can use with policymakers, with other agency leadership, with folks from community-based organizations, to help build that set of strategies that will lead us through whatever the pandemic throws at us next, and hopefully into the recovery.
Well, shoot, that sounds like a scientific experiment to me. You had a hypothesis.
Yep.
You designed an experiment, you had methodology, you collected data. The data was primary data from individuals who, their stories and their answers to the conversation with the data, not necessarily E. coli that you were growing or transforming, cells that you were, or cell lines you were transforming. And then now you are analyzing lots of data, and you will use this to draw out, it sounds like, some recommendations, conclusions and recommendations.
100%.
Great. Would anyone like to ask questions of Liz about public health, the social determinants of health, how you can work with her? Great. We'll start with Stefan. I'm so sorry. I hate it when people do that, and it makes us easy.
So I guess I just had two questions. One for your 5,000 people. I guess I was just wondering about like how diverse your sample was, because I know you mentioned that you were doing a lot of it online, and so just like when it comes to questions of access, I was just wondering what kind of sample you were able to take. And then I guess another follow-up question that I had was, I know like with governmental agencies, like there's a lot of red tape to doing everything, so I guess I was just hoping to get your insight as to how much action you're actually able to get done after obtaining like the information, like how much actionable, I don't know, like decisions you're actually able to make.
Yeah. Those are great questions, thank you. So in terms of sampling, for the community conversations, we actually partnered with community-based organizations in 26 neighborhoods around the city, because we knew that they were the ones that knew the folks on the ground that could help us get the right voices to the table. The community-based organizations were everything from an organization that primarily served Indian American older adults in Jackson Heights, to one that served children and youth in the South Bronx, to one that served LGBTQ New Yorkers in the west side of Manhattan. So we really thoughtfully looked for organizations who we knew could bring that wide range of perspectives and voices to the table, so that we knew we had a sample that looked like New Yorkers. And those community partnerships are really at the heart of everything we do. And in some ways it gets to your second question, right? At the end of the day, we are not just trying to do government-led strategies. We are actually trying to change how everybody approaches this work. So we do have a lot of resources at our disposal that we can leverage. You know, I think you do hear a lot about the challenges of government and the complexity, but maybe something that you don't hear as much about is just the scale at which we're able to act. So we were able to build a public health core that serves 33 neighborhoods across hundreds of community-based organizations, that's bringing thousands of community health workers out to work face-to-face with their neighborhoods on issues related to community health. And there's really no other entity that can operate at the scale to do that kind of work. So government work is definitely challenging and requires that you learn how to push through a lot of those red tape and challenges, but it also gives you ability to work at a scale that I just don't think is possible otherwise.
Thank you. Sandy?
Hello, I just wanted to ask about, in terms of getting involved in like government research, what type of education or skill sets would you need to first have in order to be considered for these roles? Thank you.
So we really do have a wide range of roles. There are absolutely entry-level analyst opportunities that have fairly low requirements to entry. You know, basic statistical skills, thinking about statistical, like tools for statistical analysis, for example, or experience with different laboratory technologies is going to be important based on the requirements of the particular role. We also have more senior level roles that are usually occupied by people with PhDs, experience leading their own research, et cetera. But there's a wide range of opportunities and skill sets that we can tap into if you want to get involved. I will say the health department also has a fairly robust internship program, which I'm happy to maybe forward over some information about if that's something that folks are interested in learning more about as an opportunity. We have interns who come and work with us both in the summer and year-round. We have EPI scholars who come and do specific research projects with us. I will say I'm very excited. I have an EPI scholar coming to work with me. I think her first day is early next week, so we're really looking forward to that. And maybe just to give you an example of what her work will be doing, she'll be looking at our vaccination campaign in public housing communities. She'll be analyzing the data to understand the places that had rapid uptake, the places that had more gradual uptake, and those that were slow to adopt the vaccine. From there, we will analyze what the barriers and facilitators were in each of those sites in order to make recommendations about scaling up different kinds of resources in other communities moving forward. So we're super excited for that work moving forward and would love to see more folks getting involved.
Very cool. Michelle, and is there anybody else who has questions? Jesse and Stephanie.
So I apologize, this question was already covered. I know I walked in a bit late. Someone just stopped working, you know. But from what I heard you talk about, it was a lot about outreach and raising awareness. So I guess what comes after that is like granting access to those who may not have access to those, I guess, treatments or things they always do awareness for. So what steps are taken in terms of that, like after the awareness is complete, I guess?
So in terms of increasing access, I think that there's maybe three things to think about. The first are the things that we can do ourselves as the health department. So for example, during the response to COVID-19, you saw that we stood up mobile clinics to do COVID-19 testing and vaccination that were located in New York City public schools and other public buildings where we could make those resources available to New Yorkers. We stand up clinics, and we call them points of dispensary, pods. We set up those pods during all kinds of emergencies, but also bring different kinds of mobile resources to folks in their community everything from health bucks that literally give people money to buy healthy and fresh food, to exercise classes that happen in neighborhood parks, to immunizations and other kinds of resources like that. So those are things that we can do by ourselves. There's other things that really need to come from community partners. And so that's where we do a lot of contracting and work with providers, with community-based organizations, so that they can provide the kind of culturally responsive and culturally humble services and resources that their community needs the most. So that's really the second. And then the third is that we partner with other city agencies. Sometimes what's needed is, more proactive enforcement of the housing code, for example, for folks who are dealing with maintenance deficiencies in their homes. So that's where we work with the Department of Housing Preservation and Development or the Department of Buildings to really expedite services and make sure that they're headed towards the people who need them the most. There's a local law that we respond to and help to coordinate where children with asthma, doctors who are taking care of children with asthma are able to make a referral that triggers an automatic enforcement from the Department of Health in partnership with the Department of Buildings or the Department of Housing Preservation and Development to ensure that that child is living in a housing environment that's not aggravating their asthma. So that's kind of the third big way that we are bringing access, directly to the folks.
What would you say if there's a single challenge area that you're dealing with now? What are, I guess, the top one or two challenge areas? I guess tangentially, to what extent are you invested in considering things like mental health?
Yeah, those are great questions. So in terms of challenge areas, I don't think that anyone will be surprised to hear that one of the things that the pandemic really illuminated is that there have been really decades of disinvestment in the public health system overall, whether that's the workforce or the data systems or the physical infrastructure. Public health funding has dramatically declined over decades, and that takes a toll on our ability to protect and promote people's health. On the mental health front, I would encourage folks to go and seek out the address that our commissioner, Dr. Ashwin Vasan, delivered earlier this week at University Settlement downtown, really introducing the mental health roadmap that we are following as a city. The COVID pandemic also really exacerbated tremendous issues related to really everyone's mental health, but in particularly issues related to folks with severe mental illness. And so we're really working to completely transform the way that we do our work in order to ensure that mental health is embedded in every single thing that we do, and that there's no gap between how we're thinking about and responding to mental health and physical health. There's maybe one more.
All right, last question here.
Hi, so I hear you started in art, and I think that's really interesting. But you're also very clearly knowledgeable on public health, so I'm just curious to know, when you made your transition into public health, did you feel as knowledgeable? And if not, in what ways did you kind of learn along the way? And a little bit in addition to that, you also say you love to implement your art background, so I'm just curious in like a specific example on how you implement your art in your field right now.
So glad you asked that. I wanted to, and I couldn't figure out a good question. Great.
I love that question as well. Thank you for asking it. I think that the greatest privilege of my career is that I have been able to continuously learn. I have never, ever been at a point when I felt like I've got it. I've got it all figured out. I know exactly what I'm doing, and I can stop learning. And that used to make me really insecure, particularly when I sat around tables with, scientists and folks with different kinds of expertise than me. But what I've learned is that it's actually it's a tremendous opportunity and a tremendous privilege. I am constantly scribbling down authors, ideas, studies, new research, et cetera, that my colleagues mention, and really chasing that knowledge and new ideas. And I would encourage everyone, even folks who I'm betting that folks in this room have deep knowledge about one thing. If there's anything that you take away from this conversation, it really is that continuous learning and opportunity to continuously seek out new information. On the art front, one specific project that I'm really proud of, back in 2015, some colleagues and I actually organized a festival called What Creates Health. It included dancers, musicians, spoken word poets, but also roundtable discussions about everything from street safety to gun violence and mental health. And our commissioner at the time, Dr. Mary Bassett, who's now our New York State Health Commissioner and who we all kind of idolize, she came in and to give her, at the beginning of her opening remarks, she said, "Can you believe that you're at an event organized by the government?" I said, I've done my job, I can go home. But I think what that really taught me, honestly, is that there's always an opportunity to do things differently, right? We did that project using outreach funds to do a communications campaign, and it was absolutely a communications campaign. It reached several thousand people and got us to have the kind of conversation that we would not have been able to have with an ad on the wall or a flyer that we sent out. And so I learned a lot from that opportunity, but also it's the project that I hold up in my mind to this day as my greatest artistic achievement in government.
Wow. Can I ask one very last question about your necklace?
Yeah.
What is it? Where is it from? Did you make it?
I wish I'd made it. I wish I could take credit for it. It's a woven rope necklace. It's by a jewelry designer in California called Zelma Rose. I think she just closed up her jewelry business, unfortunately. But I was joking to someone, people pass down gold and jewels to their children. My daughter will be receiving a collection of strings to wear around her neck from me.
Well, that's still thoughtful. Thank you so much, Liz, for being here and for the work that you do for the city of New York and for us, the citizens of New York. Let's give Liz a round of applause. So we have a small token of appreciation for